Welcome to Dental Business RX. Practice success in 30 minutes or less.
Thank you for calling ABC Dental.
You're about to present a treatment plan to a new patient. You've completed a thorough initial oral exam. You've taken appropriate x-rays, maybe a full mouth, and have a pretty good handle on their chief complaint. They have a substantial treatment plan. It's not huge, but it's substantial. They need some scaling and root planing, 2 root canals, 6 crowns, and some smaller composites. All in all, it totals around $13,000. Your financial coordinators had a look at the treatment plan and taken a look at the patient's insurance benefits and sees that they have a $1,500 yearly maximum, $300 of which you've already used for that new patient initial exam and x-rays. So they've got about $1,200 left towards this $13,000 treatment plan. So now you have to go present this now. So what do you do? Well, if you were to ask me, flash answer, what would be my answer? I would say, of course, you just present the full treatment plan and the patient's going to have an $11,800 copayment. That's what I would say 100% of MGE clients would tell you as well. You tell a person what they need. You found X, you tell them X. That's how it works. But what surprises me is still how many doctors don't do that, who instead will only present what insurance covers, or they'll present a little bit of the treatment plan, and then when the patient comes in, present the rest. And that's what I want to talk about in this week's episode, specifically why and how you should always, almost always at least, present a patient's full treatment plan and not allow anything to interfere in the relationship between you and your patient, including insurance coverage. My name is Jeff Bloomberg, and I'm your host. And full disclosure, I was not originally planning on making this episode. This is not on my content plan, my long-term content plan. This is not listed anywhere. What inspired it was talking to a client who just purchased a practice from a doctor whose office was all insurance driven, as well as talking to a couple other clients and Sabri, who's been talking to newer clients and finding out that this is still a thing. I'd heard, I've been in the industry for a while, so you hear things like this, well, I don't present full treatment plans. And I heard it a lot more years ago. And I thought that just wasn't much of a thing anymore. I thought people just presented full treatment plans more or less uniformly. Maybe I'm talking to too many of my clients. I don't know. But so what inspired this was, I figured I got to put something out about this because this really, not only does it affect, the treatment that you're doing as a dentist, the help that you're giving your patient, it also, when you're not presenting full treatment, it starts to wreck the goodwill in your practice. Let me give you an example. And just so you know, because this wasn't part of my original plan, this episode's a little bit, what's the word I'd use? It's a little bit more casual, right? It's not as structured because this is something I just wanted to get out as soon as possible. So I was talking to this client, and they just purchased a practice from the prior doctor's policy was we only do what insurance covers. That was it. That's all they did. So day 2 in the practice, this patient comes in from the old doctor and they've cracked their tooth. Now, I don't know. I didn't get all the clinical specifics. I don't know if it was like a full crack where the tooth had to be extracted or just a cusp, right? I got the idea it wasn't like an extraction. It was like, maybe just a piece of tooth cracked off. Okay. So the patient tells this doctor, this new doctor in the practice, that they cracked it using dental floss, which, we all know is virtually impossible. So obviously there was some type of a defect or problem in the tooth beforehand. And sure enough, there was when the doctor looked at this patient's old x-rays. And I don't know how she handled it with the patient. I don't know what she told the patient. But, when she explained to the patient that dental floss could not crack that tooth, the first thing the patient said, and remember this patient came in upset, was, why didn't the doctor tell me? Why didn't the doctor tell me? Well, the reason this patient was never told was because that wasn't covered by insurance, or maybe they'd used all her insurance, but it wasn't part of the way that office operated. So maybe in an effort to avoid creating an upset of some kind, what did you end up with? A patient who was upset. That type of stuff will mess up your goodwill. So, over the years, what are the main reasons I've seen for this method of operating? I think it's a really bad method of operating. There's 2 primary factors that drive this. The first one is fear. The other is apathy. But let's take a look at this fear thing for a second. So let's say, for example, again, talking to Sabri, who was meeting with a newer client not that long ago and found that this newer client, is the first time that they're coming to MGE, was doing this with new patients, especially when the patient had a substantial treatment plan. They wouldn't tell the patient everything they needed right up front. Why? Because, of course, that's Sabri's first question. Well, they didn't want to scare the patient or make the patient think they were all about money or whatever. They wanted the patient to get to know them and see that they were good people. Okay, so this is maybe not the best analogy, but I want to just throw this out here to you for a second. I want you to imagine that your car has some problems. It's knocking, it's shimmying when you're driving, whatever. So you bring it to a mechanic and you go, look, I don't want my car to knock and shimmy anymore. This is a problem for me. So they, inspect your car and they find out that it has 5 problems with it. But you're a new customer. This is going to cost about $5,000 to fix. So they don't want to tell you that it's going to cost $5,000 because you might leave and go somewhere else. So they tell you the one thing you need to fix. You drive off, and maybe it's not knocking anymore, but it's still shimmying, right? Where is the reason in that? It's still not a fixed car. Why are you in that practice? You're there to restore, function, health, and aesthetic. You're there to make healthy patients. That's why you're there, right? So in an effort, like in the example I gave you earlier, you're trying to scare this patient or upset this patient. Well, in an effort not to scare them or upset them, rather, you're going to end up with them potentially being upset. This is where I think you see these reviews. I've talked about 30% of the negative reviews have to do with the case presentation or treatment acceptance process. I've said that before. I've said it in seminars and on prior episodes. What normally happens? Patient came to your office, thinks everything's great, and you tell them that it's not, and they freak out, right? And there's a way to do that. You want to sort of break it to them gently over time. Maybe when you're doing your exam, point out, well, this tooth seems to be missing a cusp here. Have you ever noticed that before? You can run your tongue over it. Here, look in the mirror, look on the camera. Show them that there might be something wrong so that you start to foreshadow that there might actually be something wrong. There are things you can do to sort of avoid that initial shock. But on the other side of this, some of those reviews will say, I never had dental problems and I went to ABC Dental and the doctor told me I needed $8,000 worth of work, blah, 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 blah. So I went back to my old dentist. You ever seen those? Maybe you've had one on you like that before. Well, maybe this is how this is happening. The old dentist wasn't telling him what was wrong because that's still, I guess, maybe not a big thing, but it's still a thing. It still happens. I'm seeing it. So it can have a lot of negative effects in a number of different facets or ways. Ultimately, you have to look at it from this perspective. And this is what I tell a client. You are the technician. So you are looking in my mouth and you're looking at what do you have to do to restore my health, right? And obviously, I'm going to say all kinds of things when you're talking to me. And all those things are doing is giving you an idea of who I am. If I tell you, well, I only want to do what insurance covers, well, you know that you're going to probably have a little bit more work to do to bring me around if I want to restore my health, okay? That's all that really tells you. It doesn't make me a bad person, right? That's something to think with here. But, patients say things. I had somebody tell me the other day that if a patient decides that, they don't want to sign up for treatment now, you've told them the treatment that they need, they don't want to do it right now, or they want to do something else or pay for something else or go on a cruise or whatever, that they're quote unquote not interested in their teeth or not interested in their treatment. I mean, you could say that sort of at first glance, but that's not true. It doesn't mean they're not interested. It means that they don't understand the treatment plan. If they really understood the importance of it, that's where you can sort of get this disconnect. You've explained what a person needs. If you were them, you would accept this treatment plan. But then, they're on the other side and they're saying something that makes no sense to you. They want to go on a cruise. They want to go buy something new. And you kind of get upset a little bit. You go, well, how could someone think that way? You're trying to explain it to yourself, essentially. All you have to know, it's not that they don't care about their teeth. Sure, there are people who don't care about their teeth, and I'll talk about that in a second. But for the most part, all that means is they didn't really get the importance of what it is you're trying to explain. So we get into this concept of being afraid of telling people what they need, right? So you've looked at what a person needs, and then you don't want to tell them what they need because you're afraid it's going to create some type of a negative effect. Well, the first question I would have for you if you told me something like that is, has that ever happened to you? Now, you most likely will say, yes, I told this patient that they needed $16,000 worth of treatment, and they got very upset with me. Okay, so let's say you say, yes, that has happened to you. My next question would be, how many times has this actually happened to you? I want you to really take a look at that. How many times have you told a patient what they need and a new patient specifically, because that's probably not going to happen with patients that you've built, some trust or rapport with. But you've told a new patient what they need. How many times have they turned around and gotten horribly upset with you? Probably not that many. I would guarantee you could count it on your hands. It hasn't happened that much. But here's where this goes wrong. So it happens to you once or it happens to you twice, and you go, well, I don't want to ever deal with that again. So instead, what I'll do is I'll change what I'm doing and stop presenting full treatment. So let me say that again. So you present a treatment plan to a new patient, they get upset with you about the fee, maybe they leave a negative review and leave your practice, and you go, whoa, I can't ever have that happen again, so I'm going to change. Maybe it happens to you twice, right? You did it once, you go, it's a fluke. Second time, you go, okay, this can never happen to me again. So I'm going to change how I do things, and I'm only going to present, this little bit of treatment because that's not going to upset the person, and they'll get a chance to know me, or whatever the reasoning behind it is. Okay, so a couple things to know here. 20% of the people that come into your practice are going to be a problem. That's just the way it works. It's a law of averages. It's how it works. 20% of the patients that come into your practice, 20% of people going to business are going to be trouble. That's just generally, you might think in your area it's 80%. It's not 80%. I guarantee you it's 20%. Okay, which means 80% of people are going to be relatively cool. They'll be sort of all over the place. Some might be cool. Some might be, somewhat dour, maybe not that happy looking, but they're okay. They're not bad people, okay? But 20% are a problem. So you start dealing with these trouble patients and you hit one or two, and then you start thinking everybody is that way. And where you screw this up is you then change what you're doing. And it's almost like you forget the patients that you did it correctly with or that it went well with because it went bad with this one. And this is just a funny thing that happens. If you see 20 patients in a day and 19 are every degree of, nice, happy, maybe they're not happy, but they're at least adequately satisfied with what you did. But one is just completely off the rails, right? They're just nasty, mean to you, mean to the front desk. Who is it everybody is talking about later? They're talking about that one person, not the other 19 who were just really nice people. Okay? They're talking about the one. Who are you talking to your significant other about that night? You're talking about that one nasty person. This is what happens. It sticks in your mind. Where you go wrong is if you try to cater to that one nasty person. Because truthfully, let's say you say, look, this is what you need. You need X, Y, and Z. And they go, well, that's not what I want to do. I just want to do what's cheapest. I just want to do what insurance covers. And they're really stuck to this. This is just what they are all about. They want the cheapest solution possible. The guy down the street charges $6.99 for implants. This is where they're at. Well, guess what? They may not be the proper patient for your practice. Maybe it's a bad fit, okay? It could be a bad fit. That is very, very possible, okay? And you have to be all right with that. You can't cater to everybody. If you're an apple juice factory, you can't bring oranges in. You want patients who actually care about their teeth. And what's funny, if your whole viewpoint is, I'm going to do what's best for my patients, I'm going to restore health, function, aesthetic, I'm going to make healthy patients, this is what this practice is all about. Well, if I come into your practice and I want to be a healthy patient, well, we have some basic, agreement here. You and I agree this is a good thing. I'm going to probably stay in your practice. You're going to retain me. Whereas that other individual who comes in and says, I just want what's cheapest, I just want what insurance covers, blah, 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 and it becomes a problem, is probably not going to stick with your practice. They're going to go shop around, in which case, fine, they don't belong in your practice anyway, folks. You can't please everybody. But where you go wrong is when you start to cater to the lowest common denominator in the practice, like someone who's just a real problem. Look, it's 20%. It's 1 out of 5. It's not going to be 80% or 90%. It's a very small percentage that are going to give you a hard time, and they're just not going to be satisfied. And that's okay. You probably, if you do things right, you'll end up with, you may have less, and that's okay. But if you end up where you're trying to cater to these folks and this is all you're doing, well, they only want to do insurance covers. They want to get half off. They don't want to pay copay. Then what are you doing? What kind of practice are you running there at that point? You see? So that's where you mess this up. You start to okay, so this one person gave you a hard time. So now you decide, you forgot that you told 8 patients exactly what they needed and they weren't upset. Maybe they didn't all pay for it, but they weren't upset. But that one person was nasty about it. So no, I'm going to change everything because I don't want anybody to be mad at me anymore. What is that? All right. And the horrible part about this is that, I hate to use the word fear because it's not like you're petrified, but you're scared of losing patients. How's that? All right. That being afraid of losing patients and catering to this idea that you're going to lose patients. You're not going to present full treatment, or you're only going to present what insurance covers, right? That starts to become the way you operate. If you do that long enough, you start to become apathetic about it. Okay? So what do we mean by apathetic? It's not that you don't care. It's just that there's no point in bothering anymore. You're just in apathy. You're apathetic about it. So you've had enough patients, have given you a hard time about only wanting to do what insurance covers, right? Again, I would say if that was how you were operating, I would say, well, how many was it actually, right? Just like with the new patients, where you're presenting full treatment, how many was it actually? You'll find it's probably not that many. But then you change to the point where you go, okay, I'm just going to do it this way. We're only going to do what insurance covers, and that's just what we do. And then eventually your career, your work life doesn't look so fun anymore because you didn't become a dentist to do this. And you do this long enough, instead of being the technician and doing what people need, right? You change. You just kind of sit there and you go, well, that's the way it is. I'm just going to do, there's the reality and there's what I believed I could do when I opened my practice, right? I'm just going to do what insurance covers, and that's all people want. That's not what all people want. Some people want that. And maybe those people aren't good patients for your office. And maybe some of those folks, and this is the horrible part, if you actually talk to them, you could change their mind and they could get excited about restoring their health, right? And it's funny, this same client who just purchased this new office that was very insurance driven was finding all kinds of patients that needed, really needed some type of periodontal therapy, but they were on 6-month recalls. This office was doing 0 periodontal therapy. They're just on 6-month recalls, not even 3-month recalls. So what did they start doing? They started talking to these patients and going, hey, we need to do some scaling. Hey, we need to do this. And you know what's funny? These patients accepted. They were happy to do it. That if they're coming to your office, your patients are not dentists. They're coming to you because they want help. And these patients don't bite. You can actually help them. So ultimately, my recommendation to you would be you do whatever exam that you do. You come up with whatever treatment plan. You're the doctor. I can't influence how you operate clinically, and I wouldn't even try even if I was a doctor. Okay, you're the doctor. You went to school. You've done your CE. You know what you're doing. Figure out what this patient needs. Find out what their level of, understanding is. You have an idea of what the estimation is going to be to make them understand what they need. Spend time explaining it to them and tell them what it is and tell them the cost. The cost maybe some people can afford it now. Some people might have to do it in pieces because it's just impossible for them to afford. But what's funny is the majority of patients, if you do that, will really appreciate you because they came to you for help. You want to help them. They want help. And you have an instant level of agreement there then at that point, and most will do it. Especially, if you get better and better at communication and sales. This is my shameless plug of the episode. I definitely recommend that you do the MGE communication and sales seminars. We also do some professional sales training on DDS Success. I'll put the links on the episode webpage. But if you're good at communicating with patients, tell them exactly what they need. The majority of them do it. And what happens as a result of that? A lot of cool things happen. Number one, you're doing the type of treatment that you love to do. You're really getting the type of product you're looking to get with your patients, a healthy patient. Number two, your office collects more, which that's cool, right? But number three, the most important thing is you have healthier patients. This is what this is all about anyway. Okay. So that's more or less all I wanted to talk about this week specifically, because again, I didn't realize this was even still a thing. If you're listening to this and you're in any way allowing what the patient's insurance level of insurance coverage is, or being afraid you're going to blow this patient off to dictate how you're presenting treatment, I would tell you, please, please, please stop. Do what's best for your, and I know the funny thing is you want to do what's best for your patients, right? So just tell them what they need. It's really easy. They don't bite. I guess maybe some do, right? But they're not going to bite you, okay? Maybe they might get a little upset because nobody ever told them that before. Well, be understanding. In a lot of those cases, you can sort that out too. Or maybe you really have that trouble patient who really just doesn't care and wants to make you wrong, in which case, fine. Maybe they're just not the right fit for your practice. That's why we have things like a Dental Practice Act, which explains how you can discharge a patient. And better off to find that out now before you're involved in any type of heavy treatment plan. Anyway, it's a shorter episode. That's all I have, but I felt it was important enough to talk about. I do hope that it helps, and I put those links for you on the episode webpage. If you have any questions, you can always contact me at jeffb@mgeonline.com. You can look us up online if you have questions about our company at mgeonline.com, or call us at 800-640-1140. Folks, have a great week, and I will talk to you at the next episode.